One thing you'll notice is the open console design is something that we did that is also a bit different in our hardware architecture. You'll also notice that it allows direct communication with the surgical team, as well as easy just checking on the patient and other folks for the operating room staff. One of the things that really does differentiate our hardware technology is this V-wrist. So the bedside units mimic the human arm. They have a shoulder joint, an elbow joint, and a wrist joint. And that wrist joint actually allows us to do multiple things. Number one is it allows us to keep that small form factor. And if it wasn't there, for example, the arm would have to actually reach over the patient and then come back into the abdomen, which when you do that, you then increase the weight of the arm, which then you must also increase the ballast point to counteract it. So that wrist allows us to have that small form factor in the bedside units, which allows easy access to the patients. The other thing that's nice about the V-wrist is it does take a rotational element out of the instrument itself, out of the instrument shaft, and puts it into the arm. And what that allows us to do is to shrink the size of the diameter of the instrumentation down. So that's something that's also beneficial for smaller port sites, which we have. The other thing you'll notice is the surgeon here has the freedom to sit or stand. And that's been nice for folks from an ergonomic standpoint. So the other thing that's the versatility kind of comes into play there. And I think that's something that, is beneficial for folks that really want to understand a little bit more of the ergonomic benefits that you can get when you're doing a robotic procedure. Well, why don't I just open it up to a Q&A? But what I was talking about was there's a few things when it comes to robotics that are beneficial to both the surgeon and the patients. And one of the things that we've really looked into was operating room flow, as well as the surgeon ergonomics. And part of the idea of the open console, that modular design that we have, is so that the physician's able to have a direct line of communication with the operating team, their operating room team, and the staff. So that's been there's nonverbal cues and verbal cues that the surgeon at the console can perform without interrupting the surgery. The other thing that's nice about our small footprint is it allows for easier access to the patient. Another thing that you may have noticed in the video was the small form factor near some of the operating room staff. One thing that's nice about some of the software that we've done with the system is if the robotic arm is performing a movement and there's somebody next to that arm, the arm will actually sense that pressure and stop. It won't just kind of like a manufacturing robot just continue in the movement that it wants to go in, regardless of anything that might be impeding its path. So the idea with this is it's a little bit less intimidating for the operating room staff. It also reduces the potential for injury. And the other thing that's really nice about this is if you are to apply pressure and move an elbow of the joint while the operation is going on, it actually does not impact the end effector. So what that means is you can actually move the arms during the surgery without interrupting what the surgeon is trying to do at the console.